All right, so it is our big ticket heart event. It is tomorrow at the Jacksonville Fairgrounds. And if you have never been before, this is your chance to talk with cardiologists, pharmacists, nutritionists. We'll have Walgreens in the house. Memorial Hospital helps us get this off. And a lot of freebies as well. So joining me now, we have the founder of Take It to Heart, Dr. Scott Baker. This is near and dear to your heart with Baker Gilmore Cardiovascular Institute. We appreciate the work that you do every single year. And this year, you are excited about an addition. And you really fought to make this happen.
We are, I'm excited every year, and each year we try and add something to keep it fresh and interesting for folks. And this year we've added two additional things to the event. One is we're going to have resuscitants and instructors to teach people CPR.
Right.
We'll also have some AEDs, which are the defibrillators people may see up in buildings, and we're going to give some instruction to make people more comfortable with those.
Using them. And those are the things that really, in the end, will save a life. If someone drops and you perform CPR and you don't get a response, AED is really the next step.
It's actually the first step.
Okay.
If you had an AED, it increases by over 10% the chance of successfully resuscitating somebody.
Right.
And it's not hard to use, but it's like anything. If you've never used it, it's a little intimidating. So we're excited about that.
Also, we did a story earlier last week about the link between diabetes and heart disease. And now with a simple test, you'll be able to tell someone if they don't already know that they're diabetic.
Traditionally, diabetics have pricked their fingers and dripped blood on a strip and seen what their blood sugar is at that moment in time. And that's very good, except that particular, your blood sugar can vacillate so much. You eat a candy bar, you go out and exercise, it's going up and down. So over the last several years, a more sophisticated test has been developed, which is a more accurate way of both diagnosing diabetes, telling whether diabetics are adequately controlled, and also helping to predict how likely you are to become a diabetic. And this is a blood test called a hemoglobin A1C. And the exciting part of this blood test is you do not have to be fasting to get an accurate reading. And we're going to be providing that for the vast majority of people coming to Take It to Heart, which is very exciting to me.
And not people who already know that they have diabetes. This is really trying to figure out those people so that they can make those lifestyle changes so that they can protect their heart in the meantime.
Correct. Take It to Heart is not set up to treat patients.
Right.
It is set up to screen people, to give them information so they can get treatment themselves. And so if a person already has a diagnosis of diabetes, most likely they're under care by someone.
Hopefully, right?
And they will have access to that information. What we're trying to do tomorrow is have available for a wide range of people the ability to have this test when we find that they're maybe higher risk for diabetes, to give them valuable life-saving information that they may not have had access to.
And we'll also do our traditional checks, checking blood pressure, cholesterol, body mass index, another important one. And then the next step, which I think is very exciting, is to get the opportunity to talk with you, cardiologists, nutritionists, also pharmacists, because we have found that a lot of times people know they have something, but they're not taking the medication to control it.
Correct. And so we have a complete spread of professionals that a person might want to have access to who may not have access to. We're going to have lots of nurse practitioners to help provide additional information. It should be a very exciting event tomorrow.
Well, last year we saw 1,000 people, so we're hoping to increase that number. We're ready for you, and we get you in and out. That is for sure. And then after you get all that very valuable health information, you take home one of these, a green Take It to Heart t-shirt. You can do all kinds of things with it. You can tie it to the side, you can tuck it in and wear it very comfortably like Ann is there. It is the perfect t-shirt to get you through your summer. Also, we have Janae, who is modeling it with the hottest new pants of the season. She has paired it with gold hoop earrings and has tucked it in beautifully. Now, you do not get the accessories, Bruce, let me be clear, but those t-shirts will be yours tomorrow for the price of nothing. Just come out to our Take It to Heart event. We kick off at 7 o'clock in the morning. Seriously, guys, it is an important event. You all come out every single year. I love to see you. I love to hear your stories, and it really can be life-changing if you make that appointment. Dr. Baker, appreciate you coming in. Appreciate all the work that you have done for 12 years in this Take It to Heart event. All right, over to you, Jen.